Okay, hello again. We're going to start or move on with our third video recording of our drug profiles of our opioids and pain medications, and we have to talk about fentanyl. A synthetic opioid is to treat moderate to severe pain, high abuse potential. This drug is 100 times more potent than morphine. When it first came about, it was just used for anesthesia. And I think it should have stayed there, but it didn't. Several dosage forms, parenterally, transdermal patches, buccal lozenges would be on the side of the mouth. Most recent was a lollipop on a stick. It was originally intended for cancer patients only. Many prescriptions from 2001 to 2003 for neck, back pain, and workman's comp cases raised concern about misuse. I don't know why orthopedic doctors ever did this. Because it just sent people into all kinds of problems, respiratory arrests. Okay, here's our Demerol meperidine hydrochloride, synthetic opioid analgesic, used with caution in the elderly, long-term use in cancer patients that they don't use anymore because of the norepinephrine, the metabolite that hurts the brain, and anyone with kidney dysfunction. And again, normeperidine, after a long-term use, can accumulate and lead to seizures. After 48 hours, it accumulates in the body and it's very toxic. So it's not the drug we use anymore, but they still use it, so we have to talk about it. Methadone, synthetic opioid analgesic. It's the opioid of choice for the detox treatment of opioid addicts in methadone maintenance programs. So usually if you see somebody on methadone, they are an addict. They use in heroin-addicted patients, or those in methadone maintenance programs. Renewed interest in cancer patients for methadone. It's eliminated through the liver, which makes it a safer choice than others for anybody with kidney disease. They would use methadone other than other opioids. So other than that, when you see it, you're usually giving it to an addict. And then our Oxycontin, our oxycodone hydrochloride, structurally very close chemically to morphine, has comparative analgesic properties. A Schedule II drug, remember those are the strongest, available in oral solution, tablets, capsules, not an injection. So again, if you see the Oxy-IR or Oxycontin, it's going to be in some form of an oral solution. When it's combined with acetaminophen, they call it Percocet. When it's combined with aspirin, it's called Percodan. So again, very kind of an easy way to remember. If you can look at the Percocet, the CET, acetaminophen is Tylenol. I don't know if that helps. And then Percodan, I don't know how you're going to get an out of aspirin. But anyway, if you know Percocet, you know is acetaminophen, then you know the other one is with aspirin. Hydrocodone is a somewhat weaker used opioid, and when it's combined with acetaminophen, that's Vicodin, one of the most common drugs prescribed today. And then here we have our Narcan, or naloxone hydrochloride, and this is the one you need to put in your brain. It'll be the easiest one to remember because it's the only one. It is a pure opioid antagonist, meaning Narcan is the one we give to stop the analgesic reaction or the opioid reaction. It works as a blocking drug to opioid drugs. It does not produce analgesia or respiratory depression. It stops it. It is indicated for induced respiratory depression from opioid administration and acute opioid overdose. Narcan is only available in injectable form. The ER people are very familiar with this. If somebody comes in with an opioid overdose or people don't know, they give them Narcan. IM. Boom. Usually works very effectively, very well. Sometimes it can stop the action so quickly, depending on the overdose, the people can seize. But we're trying to keep them alive. And where I work, I use it a lot of times if the mom comes in and is addicted to opioids. The baby is born with opioids on board, and we're trying to keep them breathing. So we have to give them Narcan before we can get them on some kind of a maintenance drug. So I've given a ton of this drug. Also, if it's not an addicted mother, but they gave the medication within 4 hours of delivery, You have to remember when they're medicating the mother in labor and delivery, they're medicating an adult. Well, all of that drug goes through the placenta to the baby. So now we've got this baby. It doesn't even matter if it's a 10-pound baby, but they've got an adult dose of a narcotic on board. So it's great stuff. It's a nurse's friend, Narcan. So now I want to talk a little bit about our non-opioid analgesics. Most widely used one is acetaminophen or Tylenol. Mechanism of action very similar to the salicylates. It blocks the peripheral pain impulses by inhibiting prostaglandin. Inhibits prostaglandin. So does ibuprofen. Aspirin, very similar. Acetaminophen also lowers body temperature by acting on the hypothalamus. So we know we give Tylenol for fevers. Heat is dissipated through vasodilation. Everything dilates and increased peripheral blood flow. It has a weak anti-inflammatory property in comparison to NSAIDs. So it will help pain somewhat, but NSAIDs is the powerhouse, the non-steroidal anti-inflammatory drugs for inflammation, but NSAIDs also carry some side effects that we'll look at in a minute. So what is acetaminophen or Tylenol used for? It's to treat mild to moderate pain and fever, drug of choice for children and adolescents with flu syndromes. Use of aspirin in these populations can produce a Ray's syndrome, which is a brain wasting condition. So again, if you see a question on a test and are we going to give aspirin or Tylenol to a 3 or 4-year-old, we are going to always give Tylenol. Always, because we don't want to chance the fact that they could get this brain wasting condition. And here's Tylenol contraindications as known drug allergy or liver disease. Tylenol is taken down in the liver. When people overdose on aspirin and NSAIDs, they may bleed out. They may bleed a lot, but Tylenol will ruin your liver. Literally, people have killed themselves by taking too much Tylenol because it's detoxing the liver. Other than that, it's a relatively safe drug. Very, very few side effects. Potentially lethal. There it is, bolded. Causes liver failure. Standard maximum daily dose of acetaminophen for healthy adults is 4,000 milligrams, but it's always on the bottle. Long-term ingestion can lead to nephropathy. That would be kidney also and hepatic necrosis. Alcohol is potentially dangerous. Chronic heavy alcohol abusers may be at risk for liver toxicity from excessive Tylenol use because alcoholics have trouble with their liver to begin with, because alcohol is detoxed in the liver also. So again, if you've got an alcoholic or if you've got somebody with hepatitis, we're not going to want to give them Tylenol. Okay, now we're going to talk about aspirin and NSAIDs used for management of pain, especially arthritis and inflammatory conditions because it's anti-inflammatory. Side effects include bleeding, very, very, very big for our GI bleeders, anybody that has problems with their platelets or thrombocytopenia. It can cause swelling, but the big one is bleeding and lowering platelets. And here are NSAIDs again. Most common prescribed drugs, 70 million prescriptions a year, represents 5% of all prescriptions, more than 23 different NSAIDs in the United States. Inflammation, signs and symptoms include pain, fever, loss of function, redness and swelling. Rheumatism is a general term for any of several disorders characterized by inflammation, degeneration, or metabolic derangement of connective tissue structures, such as joints, tendons, muscles, and ligaments. NSAIDs is the go-to, including ibuprofen, naproxen, Advil, Aleve, all of them. Possess analgesic for pain, anti-inflammatory, anti-rheumatic, antipyretic is fever, analgesic is pain, and anti-gout. So it really is a whole big huge package. Relief of mild to moderate headache, myalgia, neuralgia, arthralgia, menstrual pain, reduction of fever, alleviate post-op pain, inhibit platelet aggregation, again, can cause bleeding. Relief of pain associated with arthritis, any of the joint problems, gout, hyperuricemia. Founded in 1899, so it's very, very old, became the most used drug in the world. It causes major adverse effects. Again, GI upset can cause, the reason it causes GI upset is because of the bleeding in the gut, and renal impairment, Contraindications to our NSAIDs would be an allergy, or again, any condition that places a patient at risk for breathing. Rhinitis, it's risk for nosebleed. Vitamin K deficiency, anybody that has a platelet deficiency whatsoever. Peptic ulcer disease, it will make their belly bleed. Pregnancy, risk of bleeding and possible miscarriage. They should not be taking NSAIDs. They should take Tylenol or just lay down, take nothing. Severe renal and hepatic disease, we're not going to give it. Not recommended for nursing mothers as it will be excreted in the milk. Okay, now we're going to talk about adverse effect and toxicity of salicylate, aspirin. GI disturbance, again, very similar to the NSAIDs, to GI bleed, mucosal lesion, and ulcer. Toxicity is also known as salicylism, can result from short-term high doses or prolonged therapy with high or low doses. Most common manifestations or symptoms of chronic overdose is ringing in the ears, tinnitus, and hearing loss. In children, it is hyperventilation, dizziness, drowsiness, behavioral changes. They can have metabolic acidosis. Respiratory alkalosis occurs in chronic salicylate intoxication, and hypoglycemia can be life-threatening. So again, we have to use responsibly. And then I have a note here that aspirin is the oldest NSAID, and it's the prototype that the rest of them are made from aspirin. When the pH is up, the bicarb is down, so it's alkalosis. Bicarb is down with an overdose of this, Management of an overdose of salicylates. Acute salicylate toxicity usually results from the ingestion of a single toxic dose. And I've just put these numbers on here. You can read through them. I am not going to hold you to this, but this might be good for a drug card in the future for you. So how are we going to treat an overdose or intoxication? We have to remove it through gastric lavage. Activated charcoal is what they've always used. And gastric lavage means we're going to put a tube down their stomach and pull it out. That's lavage. We're going to wash the gut. Treat the fluid and electrolyte balance. We know they're going to be in an alkaline state. Enhance the elimination through alkaline diuresis by IV administration of sodium bicarb. If the kidneys shut down because of the renal involvement, they have to go on dialysis. Okay, we're going to stop here and we'll start again with the next one. This, I believe, is video 3.